According to the Nigeria Center for Disease Control, 23 cases were recorded in Kano, 5 in Gombe, 3 in Kaduna, 2 in Borno, 2 in Abia, 1 in FCT, 1 in Sokoto, and 1 in Ekiti. In its tweet on Monday night, the NCDC pointed out that the total number of those discharged is 188, while 22 deaths have been recorded. Elsewhere in Kaduna State, the Chief of Staff to Kaduna State Governor Muhammad Sani Dattijo has said the Governor Nasir El-Rufai is not in the intensive care unit as speculated on social media platforms. Muhammad Dattijo in a tweet said El-Rufai was working from the isolation center. Lagos State has recorded fresh COVID-19 related deaths. Lagos State Commissioner for Health, Professor Akin Abayomi, made this known on Tuesday. He stated that although the state had no fresh cases as at Monday, there were related deaths from coronavirus. According to him, one of the deceased was a 45-year-old Nigerian who returned from India in January this year. So far, Lagos State has recorded 379 confirmed cases, 98 has been discharged, 260 active cases, and 16 deaths. In a related development in Benue State, government has ordered the closure of all entry points with 6 states and Cameroon. The state deputy governor made this known at a stakeholders meeting in Makurdi.
To identify the entry points for the Cameroon-Nigeria border, it is a town called Apande. For Nasarawa State, we have 2 major points, even though there is a third one which is in Goma. But we think that is not much. That is not where much is happening. So much is happening at Lafia, and so at the end of in Yelewata, there will be a need for this task force to be stationed there. And then the major one from FCT, that is our biggest concern, is the one coming through Oweto in Agatu. People don't even come here as much as they are coming from Agatu through Loko in Nasarawa State. So the task force there must make sure that they do a proper job, because the rate at which infection is taking place in the FCT is becoming alarming.
Kaduna State government says it will review the lockdown order, but however stopped interstate travel. In Warri, Delta State, the isolation center with 100 beds for coronavirus patients is in place. Zonal Medical Director of Central Hospital Warri, Dr. Paul Ukumbo, comments.
We have isolation center as well as a treatment center right here in Central Hospital Warri. And that center is fully ready, fully equipped. His Excellency, the Executive Governor of Delta State, Senator Dr. Ifeanyi Okowa, has done extremely well in setting up the center as well as equipping it with both equipment, and of course the staffing is also there and very well trained.
Sharon Ajayi reporting.